Hey everybody, Eric Mitchell. Super excited to have Gina Wallace with us today. We're going to be talking about health benefits for 1099 independent contractors. Um, what does that mean? And I'm going to tell you, team, I've had personal pain when I went from being a W-2 employee from a big company with health benefits to being independent as an independent contractor. And now I got to go find my own health benefits. Google is not my friend. Like Google did not help me, and I'm pretty good with Google, and it took me to places. I went into the abyss of the healthcare industry, a health insurance industry, trying to find help. And so when I met Gina and Gina and I started chatting, I was like, wait. Like you just help people with this? Like you just she's like, yeah. Almost like you're looking at me like, yeah, that's what I do. Like
My job.
I was like, I have struggled, and I would Google search health insurance broker near me, health insurance help. How do I do? Like I Googled everything I could think of, and it took me to these just horrible websites with 1-800 numbers where a telemarketer would call you back in 3 days, and it's like, oh my God, I cannot do this.
Or stalk you for 3 weeks.
Or yeah, I get a whole bunch of text messages, and then it's from somebody who doesn't know what they're doing.
Yeah.
And
Yeah.
so for those of us in the mortgage and real estate space, we know those people in our industry, and we would never get real estate or mortgages from them because they don't know what they're doing. And so
Right.
I have personal experience that that's not good. It's not a good strategy.
Right.
And so the purpose of today is for Gina to help us understand just some basic options, some basic understanding. If you're looking for health insurance for yourself, for your family, you're independent, what does this look like in the universe? And Gina and I are both based in California, so some of this is going to apply to California, but we'll try and delve into, what's relevant to California, what's relevant to all, the rest of the country as well. And then at the end, Gina is going to post her contact information. If you have questions directly, just shoot an email to Gina or call her, and she'll be able to help direct you in one direction or the other. And with that, Gina, let's dive in.
Yeah. Well, thank you so much. So I'm the owner of Regency West Insurance. I've been life licensed for 30 years. I've been self-employed myself for the last 18. And, my heart breaks for individuals. If I wasn't doing this for 30 years, I'd be just as confused as everybody else. So I love to handhold and point people in the right direction. So today we're going to be talking about understanding the individual health insurance market. And what is the individual health insurance market? It's for those without employer-sponsored coverage. So self-employed, 1099s, early retirees, part-time workers, individuals without group access. Where is it offered? It's offered direct with the carriers, direct to Blue Shield, Anthem, Health Net, whatnot, and also through Covered California, the marketplace. The open enrollment period is important to know. That annual window is from November 1st to January 31st. So some key dates to remember is December 15th is the deadline to enroll with a January 1st effective date, and January 31st is the deadline to enroll for February 1st effective date. If you are outside of that open enrollment window, you will need a qualifying event or proof of a qualifying event. What is a qualifying event, you ask?
I was just about to ask, actually.
It is like loss of a job, involuntary loss of coverage elsewhere, like loss of a job, a marriage, divorce, birth, adoption, a move to a new area. That's a new network, the change of an immigration status. And then if any of these, whenever these qualifying events happen, you do have a 60-day window to come on to a plan outside of open enrollment. If you miss that 60-day window, then you have to wait until open enrollment, which we just talked about. Um, it's important to know the difference between the metallic tiers. Back in 2014, when the Affordable Care Act or the ACA came into existence, they wanted insurers to understand what they were getting with what plan. And so they made all plans of a metallic level. The bronze plan is going to be your least expensive premium wise, the most expensive when you go to the doctor. These don't have anything to do with your benefits. It's actually just an actuarial percentage to tell you about how much you'll pay out overall on a plan. So the bronze plan pays about 60%, meaning you'd be responsible for about 40%. Those plans are more catastrophic in nature. So you're looking for a healthy insured or an insured that wants a health savings account, an HSA that has a triple tax advantage. Or if you have a family or kids, most of my clients start on the silver tier there. It pays out 70%, meaning you would pay out about 30%. It's for more moderate usage, and they have a cost sharing reduction assistance available on the silver level this year. So families with kids that go to the doctors more often, or if you have more of a chronic situation, silver is where you really want to start. From there, you can go up to gold. It's 80%, you pay 20. That's when you're using your benefits a little bit more. And then finally, platinum is 90%, you pay out 10%. That's when you're using your healthcare insurance frequently and you need prescriptions and see your doctors, maybe some x-rays, some images. Platinum's going to be your best bet. So Covered California is the Affordable Care Act marketplace here in California. To look at other states, you could go to healthcare.gov and put in your zip code, and they'll send you to the direct market in your state. There is financial help through Covered California right now with premium assistance that lowers your premium monthly, and also the cost sharing reduction, which lowers your copays when you go to the doctor. Eligibility is based on your income, your age, your zip code, and your household size. Now, that's for this year. The big, beautiful bill, how is that going to impact us? Enhanced subsidies right now they are ending at the end of this year. I don't know if things will change between now and then, but right now the assistance through Covered California is going away, which means households could lose $100 to $200 a month in additional assistance. You should anticipate premium increases without action. And planning ahead is really crucial. So having a broker like me or a resource to help you navigate this can be helpful, especially this year with this big, beautiful bill impact. Some key factors when you're looking for plans that you want to take into account is your network. So if you have any doctor relationships you're trying to keep or hospitals you like, you'd want to talk to your broker about that so that they can find a plan that meets your needs. If you have any prescription coverage you're taking, you'll want to check the prescription coverage because it varies per carrier. You'll want to know about the monthly budget. If you have any upcoming planned services coming up, you might want to talk about that so we can look at benefits and find a plan rich in benefits. And you have some tools to do this. Covered California has what's called a shop and compare tool on their homepage of their website. You can plug in your information and see what kind of assistance you're going to receive this year or what will happen next year. And of course, you also have guidance through Regency West, my company, who's happy to help. And lastly, Regency West offers some personalized advice for you. We are Covered California certified agent. We do free consulting and enrollment help, and we're a trusted local support for you guys. Again, my name is Gina Wallace. This is my cell phone number. Here's my email address, and this is Regency West's website. If you want to reach out, we are happy to be a resource. If we can't work with you or don't know, we can always point you in the right direction. We like to find benefits that benefit our clients, and we're adamant about helping them navigate the whole process.
Can I ask you some questions, Gina?
Certainly.
So if I'm, and I'm just going to go from my personal experience, right?
Yep.
That if I'm looking at Blue Cross, Blue Shield, and then I go over and I look at Anthem, and then I go over and I look at, Scripps, or then I go over and I look at whoever, Aetna, um, they're all different. Like they're not the same. Like there's
Yeah.
similar verbiage, like bronze, silver, gold, platinum, right? Like what you described, there's similar verbiage, but
Yeah.
how much like an example, right? Let's say I'm on a 70/30 plan and I'm going to pay 30%, insurance is going to pay 70%, but my 30% caps at a certain amount. Anything above that amount, insurance pays 100% or more
Yeah.
than, right? But all the different plans have different caps and different amounts after the caps. And then, what's covered, what's not covered. My kid has asthma, this plan covers that. This plan doesn't cover it, even though they're both silver.
Yeah.
This company does, this company doesn't.
Yeah.
Then, hey, my wife and I are thinking about having a baby, right? So maternity care, well, this
Yeah.
plan covers it, this plan doesn't cover it. An
Yeah.
HMO is good, a PPO is bad, like blah blah, like the moving parts of actually trying to decide on your health coverage based on your unique needs, really, it's incredibly complex.
Can be, yes. So here's some tips. If you're working with an agent is usually captive, so they're only working with the Blue Shield or Health Net or Anthem. You want to work with a broker because a broker works for you and they represent all of the carriers out there. And then that's why we want to know if there's any doctor relationships you have or any prescriptions you're taking or anything on the horizon, like you're starting a family, so that we can take all of that into account when quoting you. And so, if you gave, so first of all plans have the 10 essential benefits in it. So that includes maternity. So that you're going to get in all
Yeah,
plans.
so hold on. So let me dive into that one though, because I feel like I got conflicting information. I'm not saying it's right or wrong, it's just conflicting. So is it not true though that on some plans they only cover X of maternity and then
So all the
you have to
benefits.
pay Y and then other plans cover more?
Yeah, it depends on the tier that you're on and then the plan from the carrier, but all plans have maternity, all plans have preventative care, all plans have pediatric dental and vision. Now the benefits of those are different by each carrier and each
Right.
plan, but they all have to be in there.
Because I remember there was a difference between HMO and PPO for maternity, like a
So
radically different expense
yeah,
with regards to maternity versus HMO versus PPO. Can you dive
yeah.
on that
So
for anybody thinking about having kids?
when you're talking HMO and PPO, you're talking network. So that's access to doctors, not necessarily plan design. And HMO is going to be where it's that managed healthcare. So you have that primary care physician. You must see that physician every time you go to the doctor, and then they'll refer you to one within their medical group. That's going to be your least access to a doctor. The second most access to a doctor is called a POS. Um, and that it's like a PPO plan. A PPO is going to give you the most access to a doctor because you have in or out of network doctor visits. Of course, out of network, the benefits aren't as rich. Whereas the POS plan, you only have in network benefits, but you can go to any doctor you want. So the
Hold on.
net
So what is it? I have in-house, in-network benefits, but but if I go to a doctor outside the network, then I'm not covered.
that's correct. But you
So,
can
so
go to
that so then I
it's
can't go
not
to a
a
doctor
managed
outside the network. Like
it's
that.
not a managed care situation. So you don't have to go to a primary. You can pick anything you
Well, then I
want.
have to pay
You still get benefits
in network.
in network. Yeah.
But if I go out of network,
You have to pay a
I'm on
hundred.
my own.
Yeah.
Yeah, so
And
that to me is not a choice, right? Like to most people, why would I have health insurance if the health insurance isn't going to help pay for whatever it is that I'm trying to do? And so, so the reason I'm asking this, um, one of the leading causes of bankruptcy in the United States is having a baby because people don't plan, right? And they get those hospital bills start coming in.
Right.
and they literally have to declare bankruptcy to get out of it.
Yeah.
And because they just didn't plan like what is this and how am I going to get it paid for properly? And so
Yeah.
really sitting down and saying, look, we need to plan this with the right network, with the right doctors, with the right plan, with the right is incredibly important.
Yeah.
If you have a child with chronic challenges, like
Yeah.
the one that pops into my head is like asthma, right? Like it's chronic.
Mhm.
Um, or anything similar that's chronic. Like you have to be on the right plan. And
Yeah.
and
And that's why it's important if you know you're going to start a family to have that conversation with your broker so you can
yep.
specifically look at the hospitalization benefit. Um, and then every plan has an out-of-pocket max. So that's your worst case scenario. If you get in a car accident, you have to be life vac to a hospital, it's $2 million. Your plan has an out-of-pocket max. The bronze is around 9,100, and then it goes down from there. But if that in that scenario in your life fact, you're out 9,100. If you're out that, then that plan covers you at 100% for the rest of the calendar year.
Yeah, but and I'm asking out of ignorance, right? I am not an expert, right? I'm
Yeah.
just describing my trauma and my pain.
Yeah.
Like do all bronze programs for all carriers have the same out-of-pocket max? Or do the out-of-pocket max
Uh,
change based on the
Around
carrier?
this, around the same, around the same.
Okay, because I found the numbers to be different. Like the numbers were like I would compare programs like, wait, these are different numbers. So how do
Yeah.
I
So everybody on the bronze, they're around 9,100. Some are around 8,700, but they're all around that.
plus or minus? Okay.
Yeah. It really, and then it goes down a little bit in silver and a little bit in gold. It's really not until you get to the platinum level that you're down to closer to 4,500.
Yeah, it's super interesting. My perspective, because I was born and raised in Canada with
Yeah.
socialized medicine. And so all of this is just so foreign to me that anybody would participate in this type of broken system. Like to
Yeah.
me, this is just the most broken healthcare system I've ever. I couldn't draw a more broken healthcare system.
Yeah.
When you look at
It,
all of the other first world countries that have socialized medicine, which is all of them,
yeah.
other than the United States, like it's such an easier, less expensive, less headache system than this. And so I'm having somebody like you to hold our hand and walk us through, like, wait a second, how do I
Yeah.
do this? I can't imagine not having that, like having that person that can
Yeah.
help us.
Well, and you're paying for it. I get paid when you pay your premiums to the carrier, my commission is already in that premium. So they send me a commission check. So essentially, you're already paying for my services, whether
Right?
you're using it or not. So it's real important to have a broker so that you can let them know your specific needs so they can walk you through and make sure they find the right plan for your family's needs.
You're an angel, Gina. Thank you so much for doing what you do. I don't know if you
Thank
get enough
you.
appreciation, but I certainly appreciate that you're around and that you help.
Yeah,
Um, eh,
it's a little different market than what I got into 30 years ago. I need
mm,
to add a therapist, cat wrangler, firefighter in addition to health
estate
insurance.
planner.
Yeah.
Yeah,
But yeah, together we'll get through it.
got it. So everybody, here's Gina's contact information. Shoot her an email, give her a call, and Gina, thank you again.
Thank you. I appreciate the time.